Hello, I am Dr. Jeffrey Brown. Thank you for tuning in to Power to Heal. September is Sexual Health Awareness Month. Now, I recognize a lot of women suffer from sexual dysfunction, and that is not an easy topic to discuss with your physician. So today I want to help you to improve your libido, or in other words, how can you improve your desire to have sex? Did you know that there are a lot of health benefits, physical and mental health benefits to having regular sexual intimacy? First, it enhances your immune system. It decreases your depression and anxiety. It reduces pain by releasing endorphins, which is our body's natural God-given pain reliever. It lowers blood pressure, which reduces our cardiovascular risk. It improves your heart health, promotes better sleep. It improves your bladder control by strengthening your pelvic floor muscles. It improves your self-esteem, reduces stress, and also improves our brain health by releasing several key neurotransmitters that impact our brain and other organs in the body. Neurotransmitters are our body's chemical messengers. So today I want to talk about 4 key hormones that are important to improving our sexual dysfunction. Cortisol, that is our stress hormone. It is released from the adrenal glands that sits on top of our kidneys, located in the back. Now, cortisol's job is to keep us alive. It helps you fight, or it's going to help you to run. All right. So it isn't going to help. This job is going to keep you alive. Like I said, it's going to turn off those things that the body feels is not important for our survival. So I want you to picture someone attacking you, or someone attacking you, and your body's feeling threatened. Having sex is going to be the last thing that's on your mind. So that system is going to get shut down. So we live in a fast-paced, stress-filled society, right? You wake up, you check your phones, your texts, your emails. You're rushing to get the kids ready for school. You're rushing to work. You're stressed while you're driving. You're stressed at home, your kids, your spouse, your partners, bills, finances, your health. There's a lot of things that cause of stress that raises our cortisol. So of course that reproductive system is going to be shut down, right? Cortisol is meant to go up during those stressful periods, and then it's supposed to go back down to normal, and then cortisol goes back to normal, and then our health goes back to normal. But for most people, that's not happening. So there are tests that we can run to check our cortisol levels. Saliva test is one of those, right? It looks at 24 hours, spitting in these little tubes, throughout the day, so we can see the curve or the rhythm that our body has naturally for cortisol. You can also do a 24-hour urine test. That just checks the total amount of cortisol produced in a day. You can do that through your standard labs like Quest or LabCorp. And then another specialty test is collecting your urine over 24 hours in these little tubes as well. That can also measure the total as well as the amount throughout the day and give us a nice little curve. So I also recommend that you work with a functional medicine provider or someone trained to help you with adrenal dysfunction or insufficiency. As we are taught in medical school about Cushing's, which is an overproduction of cortisol, or Addisons Disease, which is an underproduction of cortisol, or basically cortisol deficiency, all right? And when you're looking at where we fall, and I mean we, meaning that the stress that affects our production of cortisol, which it doesn't go all the way to to Cushing's, it doesn't fall all the way down to Addison. There is no standard test that can help people what we call adrenal insufficiency, or people know it as adrenal fatigue. So there are vitamins and minerals and herbs that are necessary to help adrenal dysfunction. And you need someone that is skilled to guide you within this process. But more importantly, there are stress-reducing activities that I recommend to all my patients that we should be doing 3 times a day, right? So pick something, whether it's prayer, meditation, should be done daily, right? Doing your devotionals, gratitudes, journaling, deep breathing exercises, close your eyes, inhale through your nose and out through your mouth. That really resets, the stress response that's in your body. Walking, listening to music, playing an instrument, watching the sunrise, sunset, playing with your pets, watching some funny videos, comedies, just laugh a lot. I think you get the point. But you really have to make it a priority, right? Most health issues come because of stress-related issues. Like stress is just a killer to us. So it's very important that we deal with our stress. All right, so definitely get your levels checked if you know you're stressed, because this could be an important cause to why we're having problems. Now, the next hormone that we're going to talk about that's very important for having a good libido is estrogen. Estrogen has over 400 crucial roles in the body. And one of them is improve mood and also to improve our sexual interest, right? That is key. It also increases blood flow and maintaining the vaginal moisture and vaginal health, right? Obviously, if you're having pain with intercourse, you're not going to have a strong desire to have sex because it's painful. Now, most younger women, are going to have plenty of estrogen. That's not going to be a problem. But as you enter menopause, estrogen is declining, and then you're going to start to have some health issues, right? So let's talk about some things that you may not be aware of as far as symptoms go with lower estrogen. Joint pain is very common. Depression or mood changes. Brittle hair and nails. Decrease in sexual interest or function, as we spoke about. Vaginal dryness. Increase in facial hair. You see women out there with the facial hair, that could be because of lower estrogen. All right. Low energy. Weight gain, especially around the midsection. All right. And also having a hard time losing weight. They may notice that you're putting on weight, you haven't changed anything differently, but now you're gaining weight and you can't lose it. Okay. Increasing cholesterol. Aging skin. Incontinence. You're sneezing, coughing, and all of a sudden there's a little leakage of urine. All right. And also decreasing in focus and your memory. All right. So you should not be afraid to use estrogen. Right. It does not cause cancer. There are many studies showing this, despite the common misconception that estrogen causes cancer. So estrogen creates life. It doesn't destroy it. Right. Estrogen is very important for our heart health, our brain, our bones, joints, muscles, skin, and a lot more. Remember, I said there's over 400 functions that estrogen performs in our body. Now, it's important that you use bioidentical hormones. It's the same chemical structure that is found, within our body. But it's important that estrogen is balanced and supervised by progesterone. Okay? Your estrogen levels can be tested through traditional blood tests. But I also recommend that your estrogen is being metabolized safely. Now, this is not done through your regular serum blood tests. It must be tested through urine metabolite testing. Alcohol, processed foods, chemicals found in everyday household cleaning products and personal use products, these affect our metabolism of estrogen in a negative way. All right, now estrogen is metabolized in 3 different pathways. One of them is protective, the other one's not so much. So it's important that you know how your body processes your estrogen and know if you have an increased risk for developing estrogen-related cancers. Now, there are 3 different types of estrogen: estrone, estradiol, and estriol. Estradiol and estriol are the preferred estrogens that are used when you are replacing estrogen. Estradiol is the most potent and the primary estrogen during a woman's reproductive years. All right, it can come as a patch, a cream, an injection, or it can be implanted subcutaneously as a pellet. Now, estriol comes just in a cream. It is the weakest of the 3 estrogens, but it's also been found to be protective against breast cancer. Estrogen should not be taken orally, as it increases your risk of blood clots and can increase the risk of those negative metabolites that I spoke about earlier. Now, again, it's important to find someone who is skilled in testing and balancing hormones to ensure, the safety and efficacy of, utilizing estrogen. Now, testosterone is the next hormone and most famously known for increasing someone's sex drive. It's commonly referred to as a male hormone, but women also have testosterone and they need optimal levels too. All right, testosterone has many health benefits. Decreases excess body fat. All right, that's why men lose weight faster than women. All right, increases muscle tone and strength. Right, prevents that sagging of skin that women complain about. Right, you want to get that testosterone up. It increases your self-confidence. All right, and overall sense of well-being. Right, one of the reasons why women have low libido is that they don't like how they look. They don't have that confidence, right? They have that body image. Testosterone helps to improve that. It increases motivation. It decreases pain, and it also strengthens bone. All right. Now, what can cause testosterone deficiency? Well, number 1, birth control, and a lot of women are on birth control. Right? Chronic stress, like we spoke about before, or psychological trauma. All right, testosterone is produced in the ovaries and adrenal glands. So those adrenals can be affected by chronic stress. Women who've had hysterectomy can cause low testosterone. Cholesterol lowering medications, and then menopause. Once you enter that phase, it can lower your testosterone levels. So what are some symptoms of low testosterone? Fatigue, low sex drive, increasing anxiety, getting anxious, right? Muscle loss, weakness, low motivation. All right, so I highly, again, recommend having your testosterone levels checked. All right, if you suffer from any of those symptoms, and working with someone who is familiar with testosterone. Now, here are some ways that you can improve your testosterone naturally. The first is strength training, especially those large muscle groups like your legs, right? That stimulates production of testosterone. Leg presses, squatting, those are very good for helping improve your testosterone levels, right? Doing stress-reducing activities like I spoke about earlier. Increase your protein intake, take some amino acids, and also zinc can help metabolize and increase your testosterone. Now, there is no FDA-approved testosterone replacement for women, right? So testosterone has to be made from a compound pharmacy. It can be given as a cream, an injection, or again, implanted subcutaneously, as a little pellet. All right. Now, as I stated earlier, it's important to work with a provider, who is skilled in balancing hormones, especially in women when it comes to testosterone. Now, the last hormone I want to speak about and discuss is also known as the love hormone. It is oxytocin. Now, this is a hormone that stimulates uterine contractions during childbirth. At a hospital, they'll give you Pitocin, which is another form of oxytocin to stimulate, labor. All right. Now, once a baby is born, oxytocin helps to move the milk down the milk ducts, to the breast and to the nipple, and helps to form that bond between the mother, and that child. All right. Now, our bodies also produce oxytocin when we are aroused by our sexual partner and when we fall in love. Right. That's why it's earned the nickname love hormone. All right. Now, oxytocin is one of our feel-good hormones. It helps us bond with others. Now, research tells us that oxytocin effects are basically the opposite, of our stress hormones, that fight or flight response. Higher levels are associated with feeling calm, joyful, having a better capacity to handle stress. Now, research also suggests that oxytocin can potentially increase our feelings of forgiveness, generosity, compassion, and trustworthiness. Low oxytocin levels have been linked with symptoms of depression and low sexual desire. Now, other symptoms of low oxytocin include difficulty achieving arousal, all right, orgasms, difficulty feeling affectionate, having disturbed sleep, increased anxiety, feeling irritable, having reduced empathy, increased fear, and having aching muscles. Now, there's currently no testing available for checking your oxytocin levels. These are typically done with research purposes, all right? But if you suspect that you may have low oxytocin levels, there are things that you can do naturally to help to raise your levels. First thing is basically physical contact. Cuddling, hugging, kissing, massaging, giving massage and receiving massage can also help to increase your levels. And also just sexual intimacy can help increase or trigger more oxytocin relief. Studies have also shown that practicing yoga on a regular basis can help increase your levels. Listening or playing calming music. Spending time with friends and loved ones is very important. Telling someone that you love them or have meaningful conversations has also been shown to help increase your levels. Laughing, playing with your pets, and exercising regularly, right? What doesn't exercise improve, right? So, exercise is so important. So those are things that you can do to help improve your oxytocin levels. Now, you can also get oxytocin from a compound pharmacy to raise your levels. It can be the form of a nasal spray, a subcutaneous injection, or a sublingual wafer, under your tongue. So if you're a woman who's struggling with libido or sexual function, I hope this video was helpful. Now, it's important to find a provider that you trust, feel comfortable with, and has the knowledge to help you navigate through the sensitive yet very important topic. All right, thank you for listening. If you like this, please subscribe to the channel, stay tuned for future videos, and remember, you do have the power to heal. Thank you.